So when it okay, so when there's artery occlusion, what happens is there will be less blood supply to the area. So now the area is being supplied is the retina. So when retina gets low blood supply, oxygen, the retina can get less sensitive, or sometimes it can be damaged. Okay, because of that, the pupillary reflex is decreased. So that's why the RPD is positive. The RPD is in the branch arterial occlusion is absent. Okay. So this one is the findings. So for the central arterial occlusion and branch arterial occlusion, both of them happen. The retina is the color of the retina is grayish white, cloudy discolorations. However, the central retina is like it affect much bigger lah, the segmentation, and while the branch it's basically the grayish white discoloration only occur at the certain segment where the retinal quadrant supply bladder affect the vessel. It can only become grayish white, or we call it as a milky white. So that is basically what doctor has been done in the previous slide. Okay, and then one of the characteristic findings of central arterial occlusion is cherry red spot at the fovea centralis. Okay, which is this one. Okay, you can see this is the cherry red. This one. So it's actually in normal we don't see that it's like this color lah. But this one in the central arterial occlusion we can see that this darken at the fovea centralis. It is known as the cherry white. So why is cherry white? Because the vessel is occluded, right? So basically the retina does not get enough blood supply.
Bukan
so
cherry white.
Cherry. Okay, sorry.
Twisted tongue, twisted. Cherry red spot.
Cherry red spot. Okay. Why we can see that it's very apparent, okay, very visible. It is because the retina behind it is undergoes ischemic changes, so it become edematous. So that's why we can see here is this cherry red spot against what?
Retina edema, cloudy retina.
Milky white retina edema. So that's why we can see that.
Because you know that that area at the area of fovea centralis, there are area of FAZ we call it, fovea avascular zone. So dia tak ada vessel. Okay, so because of that also dia akan dia punya the color is lagi prominent lah on that area because dia tak ada vessel. And then how about C and D?
Okay, so C is also we can see the cherry red spot, but with a pattern cilio-retinal artery.
Sebenarnya C there's no cherry red spot because cherry red spot is seen when the whole retina is edematous and the only thing yang prominent adalah the area of the fovea tu. But in C, the only area yang normal is the area of the macula. Because the rest is edematous. You faham tak? Yang sebenarnya yang edematous yang maknanya kalau you can you try make it the outline of the normal area? Boleh tak lukiskan jari kat situ? Kat mana? Area yang normal. Okay. Lagi sambung. Okay, itu semua adalah normal. Yang di luar daripada tu yang abnormal. Semua tu adalah retina edema. Why these patients have this? Because this patient is special. Only 20% of patient will have extra circulation to the macula. We call it cilio-retina artery perfusion. So because of this, dia ada extra circulation dekat macula. That's why this patient sepatutnya dia kena CRAO juga. Tapi because dia ada extra circulation, so macula dia selamat. So kalau you read properly, C, can you read up for C? Read.
Central central retinal artery occlusion with a pattern cilio-retinal artery.
Okay, for D is the same for C. Cuma D ni adalah picture from the FFA. So can you read out for D?
Okay. So the fluorescence angiography showing blockage of background fluorescence by retinal edema but normal perfusion of a sector of retina in the eye.
Okay, yang normal tu dekat macula, yang ada putih tu maknanya yang dalam ada dye. Kalau ada fluorescent maksudnya dia akan ada nampak warna putih dalam vessel. So itu normal. Yang black dalam vessel tu black tu adalah yang occluded. Sebab fluorescent cannot go through it.
Okay. So next ophthalmoscopic finding. So there is the cherry red spot at the forehead, which is very characteristic of the central artery occlusion. Second, we can see that there is a cattle tracking appearance of all retinal vessels in acute phase for central, but there's also a cathedral appearance, but this one is only affected at the renal quadrant. So I don't know if you can see, but I'm pretty sure this is not clear, but actually cathedral tracking of vessel is because of poor flow of the blood vessels. So what happened, you can see that there's a segmentation of the blood inside the vessels that look like a cattle tracking. So this is how it's look. So functioning, and then you can see that so it's like this. Dia macam so dia macam terputus-putus dash line gitu. Okay. So yeah, it's actually a cattle tracking appearance.
So at the end, when the patient a few months later or after for some time, this vessel will occluded. I mean the artery become ghost vessel. Maknanya kalau you do fundus examination, you will see some line looks like the artery but is white in color. So we call it ghost vessel because of the maknanya evidence of previous blockage of the artery.
Okay, and then the third one is marked narrowing of all the retinal vessels. So why is because when there's an embolus obstruction, so basically there's a decreased perfusion to the area, so that's why there's a narrowing of the vessels. But in the central artery occlusion, there is all the retinal vessel. Meanwhile, for branch, it only affect the vessels, the branch of the vessels is affected. Okay, and then we can see that there is an embolus or plaque which I have talked about earlier. Holland-Cos plaque, platelet thrombi, and the fibrin. Okay. So now we go to the investigation or the imaging. So what can we do? We can do FFA, which is fundus fluorescent angiography. Where in those two conditions it can show the delay in the filling of the fluorescent dye into the vessel. For the central artery occlusion, there is a variable delay in artery filling. However, for branch artery occlusion, there is also a hypofluorescence of the involved segment due to blockage. So, for example, like this picture, so we can see that there is a, like you can see, there is a vessel that is not being lighted up. So this is what we call as a hypofluorescence, because the dye cannot fill the vessels due to blockage. Okay. So the second one we can do is OCT. So what can we see here is highly reflective embolic plaque at the superficial of optic nerve. So this one we can see that there's a this is a thickening of okay, so we can see that there's a increased thickening and also the increased thickening and also the reflection of the one of the layers in the retina. So it is become thickened because it is from what I read, it is because of the edema here. So that's why it's become thickened. And because there is a thicken here, so it has a shadowing there, which defined by this arrowhead. Okay. So apart from that, for the imaging investigation, we can also do lab investigation, because you know one of the etiology that can lead to occlusion, we have so many, right? So the first one we can do ASR and also CRP, protein. Why? Because we want to exclude any giant cell arthritis. And then we will treat the condition also accordingly lah. And then we can do a full blood count to check for the myeloproliferative disorder or anemia, coagulation disease to screen for coagulation disorders, and also carotid duplex ultrasound to look for carotid artery stenosis. So these are the management. So basically the goals of the artery occlusion is